Bismillahirrahmanirrahim. Quote of today is whoever is kind, Allah will be kind to him. Therefore, be kind to man on earth. He who is in heaven will show mercy on you. Today, the topic of my presentation is Health System Building Blocks by World Health Organization under the supervision of my professor, Dr. Saira. Learning outlines. Learning outlines are introduction of health system, components of health system building blocks, health system building blocks by World Health Organization, importance of block building system and recent advances. Learning objectives. At the end of this presentation, participants will be able to describe about the health system building blocks by World Health Organization and their important components. Introduction. A health system consists of all the organizations, institutions, resources, and people whose primary purpose is to improve health. The health system delivers preventive, promotive, curative, and rehabilitative interventions through a combination of first is public health actions and pyramid of healthcare facilities that deliver personal health care. Other one is the multifaceted nature of health systems and the spread of direct and indirect responsibilities across multiple sectors pose challenges in monitoring performances. Uh, First is the four nested model. In this model that is adapted from Furley and Shortell in 2001, the healthcare system is divided into four nested levels. First is the individual patient. Second is the care team, which includes professional care providers, for example, clinicians, pharmacists, and others like family members and caregivers. The organization. Examples of the organization is can be hospital, clinic, nursing homes, etc. These are the things that support the development and work of care teams by providing infrastructure and complementary resources. Uh, and the other is a political and economic environment. Examples are regulatory, financial, payment regimes, and markets. That is the conditions under which organizations, care teams, individual patients, and individual care providers operate. Another is 10 building blocks model. The 10 building blocks of primary care embraces the Starfield four pillars, elements of the joint principles and PCMH recognition standards, and other core components. The Starfield essential primary care functions of assess continuity, comprehensiveness, and coordination perched near the top of the building blocks hierarchy. This shows 10 building block model. First is engaged leadership. Second is data driven improvement. Third is implement, and fourth is team based care. Fifth is patient team partnership. Sixth is population management. Seven is continuity of care. Eighth is prompt access to care. Ninth, comprehensiveness and care coordination. While 10th is template of the future. First year blocks often supports the achievement of these functions. Now work at the first year, second year, and third years. First tier are the social, cultural, environmental, political, economic factors and ecosystem. In second tier comes the building blocks like health service delivery, health workforce, health information system, medicine technology, healthcare financing, and leadership and governance. While the third tier is community participation. WHO framework of health system. It is structured around the World Health Organization framework that describes a health system in terms of six core components or building blocks. First is service delivery, second is health workforce, third is health information system, fourth, access to essential medicine, fifth is financing, and sixth is leadership or governance. This picture shows that how health system building blocks get together, assess coverage, and after the goals and outcomes that come are improved health, responsiveness, social and financial risk protection, and improved efficiency of healthcare system. When you strengthen a health system, you improve the six health system building blocks and manage the interactions in ways that achieve more equitable and sustained improvements across health services and health outcomes. Um, People are often listed as the seventh building block. People refer to individuals, households, communities such as civil society, consumers, patients, payers, and producers of health through knowledge, attitude, behavior, and practices. The monitoring and evaluation of the framework shows how health inputs and processes are reflected in outputs that in turn are reflected in outcomes. For example, coverage and impact, that is morbidity or mortality. Examples of health inputs and processes are input can be infrastructure, health workforce, and many others. Examples of output are like interventions and available services. It is designed to address monitoring and evaluation needs for different users and multiple purposes include following. Monitoring of the program inputs, processes, and results that are required for the management of health system investment. Health system performance assessment is the key for country decision-making process. Evaluating the result of health reform investment and identifying which approach works best. This picture shows monitoring and evaluation of health system strengthening that shows input processes, outputs, outcome, impact, uh, and other. The first building block is health service delivery. Strengthening service delivery is crucial to the achievement of health-related Millennium Development Goals, which includes the delivery of interventions to reduce child mortality, maternal mortality and burden of HIV and AIDS, tuberculosis and malaria. Service provision or the delivery is an immediate output of the inputs into health system, such as health workforce, procurement and supplies and financing. Increased inputs should lead to improved service delivery and enhanced access to services. Key characteristics for health service delivery are there are 8 key characteristics. First is comprehensiveness. A comprehensive range of health services is provided appropriate to the needs of target population. That includes preventive, curative, palliative, and rehabilitative services and health promotion activities. Second is accessibility. Services are directly or and permanently accessible with no undue barriers of cost, language, culture, or geography. Health services are close to people with a routine point of entry to service network at primary care level, not at the specialist or hospital level. Services may be provided in the home, community, workplace, or health facilities as appropriate. Coverage. Service delivery is designed so that all people in a defined target population are covered. That is sick and healthy, all income groups and all social groups are included. Continuity. Service delivery is organized to provide an individual with continuity of care across the network of services, health conditions, levels of care, and over the life cycle. Fifth is quality. Health services are of high quality. That is, they're effective, safe, self-centered on the patient's needs and given in a timely fashion. Person-centeredness. Services are organized around the person, not the disease or financing. Users perceive health services to be responsive and acceptable to them. There is participation from the target population in service delivery design and assessment. People are partners in their own healthcare. Seventh key characteristics is coordination. Local area health service networks are actively coordinated across types of provider, types of care, level of service delivery, and for both routine and emergency preparedness. The patient's primary care provider facilitates the route through the needed services and works in collaboration with other levels and types of provider. Coordination also takes place with other sectors, for example, social services and partners, for example, community organizations. Seventh is accountability and efficiency. Health services are well managed so as to achieve the core elements described above with a minimum wastage of resources. Managers are allocated the necessary authority to achieve planned objectives and held accountable for overall performance and results. Assessment includes appropriate mechanism for participation of the target population and civil society. Data collection. Data collection is the process of gathering and measuring information on targeted variables in an established system, which then enables one to answer relevant questions and evaluate outcomes. The data collected includes administrative and demographic information, diagnosis, treatment, prescription of drugs, laboratory tests, physiological monitoring data, hospitalization, and patient insurances, etc. This shows the summary of main methods that are used for collecting data on service delivery system. First is routine health facility reporting system. That is regular facility data reported to regional and national levels by service providers. Second is health facility census. That is periodic census of all public and private health facilities within a country. uh, Health facilities survey. Third one is periodic survey of representative sample of public and private healthcare facilities within a country. These others show the strengths and limitations of all the systems. Second building block is the health workforce. A health workforce can be defined as all people engaged in actions whose primary intent is to enhance health. These human resources include clinical staff such as physicians, nurses, pharmacists, dentists, as well as management and support staff. That is, those who do not deliver services directly but are essential to the performance of health systems, such as managers, ambulance drivers, and accountants. The ability of a country to meet its health goals depends largely on the knowledge, skill, motivation, and deployment of the people that are responsible for organizing and delivering health services. It has been estimated that countries with fewer than 23 physicians, nurses, and midwives per 10,000 population generally fail to achieve adequate coverage rates for selected primary healthcare interventions as prioritized by Millennium Development Goals. A comprehensive human resources information system can also guide in decision making. A human resource information system ensures the cultural appropriateness of the health system, such as appropriate sex and ethnic mix of health workers, especially to encourage utilization of services among underserved or marginalized communities. For example, in some contexts, access to female providers is an important determinant of women's health service utilization patterns. Counting health workers, the occupational categories in the global atlas of health workforce. The World Health Organization framework largely draws on the latest revision of the International Standard Classification of Occupations and other standard classification of social and economic statistics. Data on 9 occupational categories are captured in the main dataset. First, physician, nursing and midwifery personnel, dentistry personnel, pharmaceutical personnel, laboratory health workers, environmental and public health workers, community and traditional health workers, other health service providers, and health management and support workers. National level data collection are from 4 main sources: population census, labor force survey, health facility assessment, and administrative reporting system. Health information system is the third building block for health system by WHO. Importance is the sound and reliable information is the foundation of decision making across all health system building blocks. It is essential for health system policy development and implementation, governance and regulation, health research, human resource development, health education, training, service delivery, and financing. Health information system provides the underpinning for decision making and has 4 key functions. First is data generation, second is compilation, third analysis and synthesis, four is communication and uses. Types of information. Health planners and decision makers need different kinds of information that include uh, health determinants. Examples of the health determinant are socioeconomic, environmental, behavioral, and genetic factors, and the contextual environment within which the health system operates. Inputs to health system and related processes. Processes can be like policy and organization, health infrastructure, facilities and equipment, cost, human and financial resources, and health information system. The performance or the output of the health system are availability, accessibility, quality, and the use of health information and services, responsiveness of the health system to user needs, and financial risk protection. Another is the health outcome that include mortality, morbidity, disease outbreak, health status, disability, and well-being. Health inequities. Health inequities include determinants, coverage of the use of services, and health outcomes, and including key stratifiers such as sex, socioeconomic status, ethnic groups, and geographical location. Good health information system brings together all relevant partners to ensure that user of the health information have access to reliable, authoritative, usable, and understandable and comparative data. Access to essential medicine. This is defined as having medicines continuously available and affordable at public or private health facilities or medicine outlets that are within 1 hour's walk of the population. Access to medicine is included in Millennium Development Goals under Millennium Development Goals 8. Recent United Nations reports that assessed progress towards the Millennium Development Goal target found that low availability, high prices, poor affordability of medicines. These are the key impediments of treatment access in low and middle income countries. According to World Health Organization framework for health system, a well functioning health system ensures equitable access to essential medical products, vaccines, technologies of assured quality, safety, efficacy, and cost effectiveness, scientifically sound and cost effective use of medicine and vaccines. To achieve these objectives, the following are needed: national policies, standards, guidelines, and regulations that support policy. Information on prices, the status of international trade agreement, and capacity to set and negotiate prices. Reliable manufacturing practices, when they exist in country, and quality assessment of priority products. Procurement, supply and storage and distribution systems that minimize leakage and other risks. Support for rational use of medicines, commodities, and equipment through guidelines and strategies to assure adherence, reduce resistance, maximize patient safety, and training. This picture shows access to essential drugs WHO framework for action. First is rational selection. Second, affordable prices. Third is sustainable financing. And fourth is reliable health and supply system. Global core list of medicines that are included in World Health Organization surveys are for common diseases like asthma, diabetes, cardiovascular diseases, depression, infectious diseases, central nervous system diseases, pain, inflammation, and ulcers. All these important life-saving medicines are included in this. Fifth is health system financing. Health system financing refers to the functions of a health system concerned with mobilization, accumulation, and allocation of money to cover the health needs of the people individually and collectively into the health system. The purpose of health financing is to make funding available, to set the right financial incentives to providers, and to ensure that all individuals have access to effective public health and personal health care. This shows healthcare financing, grants, insurance, taxes, all these continue and together form healthcare financing. Two related objectives are first to raise sufficient funds, and second is to provide financial risk protection of the population. The financing system is often divided conceptually into three interrelated functions. First is revenue collection, second fund pooling, third is purchasing or provision of services. The principal revenue collection is have to be collected equitably and efficiently. Pooling is the cost of healthcare are shared by all and not borne by individuals. While purchasing is used to or by provide health interventions that are allocatively and technically efficient. In most low income and many middle income countries, revenue collection derives from a mix of domestic and external sources. Financial risk protection is determined by how funds are raised and whether and how they are pooled to spread the risk across population groups. Direct user charges, for example, are regressive. That is, the rich pays the same fee as the poor, which deters some people from seeking or continuing care. A financing policy must grapple with the question of how to raise funds equitably, which usually implies a degree of progressivity, where the rich contributes a higher proportion of their income than the poor. These goals cannot be achieved without some forms of pre-payment and subsequent pooling of the collected revenues. That is, people pay into a pool when they are healthy and can draw on these funds when they are sick. Uh, Pooled funds can be derived from tax or health insurance contributions, and in most countries, they come from a mix of sources. This shows the donor expenditure on health in 2007 to 18 million rupees in Pakistan. The total is about 9,626 million. Sixth building block by WHO is leadership and governance. Governance in health is being increasingly regarded as a salient theme on the development agenda. Leadership and governance in building a health system involves ensuring that strategic policy frameworks exist and are combined with effective oversight, coalition building, regulation, attention to health system design, and accountability. The need for greater accountability arises both from increased funding and growing demand to demonstrate results. Accountability is therefore an intrinsic aspect of governance that concerns the management of relationships between various stakeholders in health, and all these including individuals, households, communities, firms, governments, non-governmental organizations, private firms, and other entities that have responsibility to finance, monitor, deliver, and use health services. This shows that a service delivery, human resources, medicine technologies, financing information, all bounded by leadership and governance that can be said as the base of all these steps. Accountability involves, in particular, delegation or an understanding, either implicit or explicit, of how services are supplied. Financing to ensure that adequate resources are available to deliver essential services. Performance around the actual supplies of services, receipt of relevant information to evaluate or monitor performances, enforcement such as imposition of sanctions or the provision of rewards for performances. Governance in health is a cross-cutting theme intimately connected with issues surrounding accountability. In the context of health system strengthening, it is an integral part of the health system components. Types of indicators for measuring governance. The two types of indicators has been proposed for measuring governance, rule-based and outcome-based. Rule-based indicators are that measure whether countries have appropriate policies, strategies, and codified approaches for health system governance. In the health system context, these indicators include the existence, for example, of a national assessment medicine list or a national policy on malaria control. Outcome-based indicators. These measure whether rules and procedures are being effectively implemented or enforced. Based on the experience of relevant stakeholders. For health system, examples may include the availability of essential medicines in health facilities or absenteeism of the health workers. Recently, the World Health Organization, World Bank, and USAID jointly developed a guide to undertake NHA in low-income countries based on SHA adapted to meet the needs of low-income countries. Now coming towards the recent advances. This is an article that shows the measuring the health system impact of diseases control program. That's a critical reflection on the World Health Organization building blocks frame. Important features that are written are as the framework in general, the World Health Organization building blocks framework is valuable because it creates a common language and shared understanding. However, for applied research, it falls short of what is needed and holistically evaluate the impact of specific interventions on health system. The ubiquity of the framework provides a common language and facilitates a shared understanding that is useful. One common framework in the international community is more helpful than having multiple potential frameworks. Another article about strengthening health system building blocks, configuring post-COVID-19 scenario in Pakistan. This shows that good governance with inter-provincial harmony, increasing fiscal space for health, and investing in good resources for health, establishing an inventory management system, promoting the use of information for decision making, and tailoring service delivery by recognizing the local context and wider system values are essential elements to strengthen the health system. An overarching political will is needed to ensure whether the interventions in each block are succeeding. Well integrated and locally grounded health system may be more resilient to external shocks like COVID-19. Now coming towards the MCQs. First MCQ is the collection of administrative and demographic data along with the diagnosis of different diseases are the examples of data collection in healthcare systems. This is a pivotal step in service delivery of healthcare facilities, which involves option A is gathering information in relation to person's state of ongoing health. Second is counting the number of illnesses a person has. Third is C, assessing cost of healthcare, and option D is measuring outcomes.
A.
Yes, option A is the right one. The World Health Organization is a specialized agency of the United Nations that is responsible for international public health. According to WHO, there are 6 building blocks of healthcare system. However, one of the following can be said as the 7th block in healthcare system. Option A, finances. Option B, politics. Option C, people. And option D, vaccination.
A, finance.
C.
People is the right answer, option C. MCQ third is a person names XYZ belongs to United States and claims that he has access to all necessary and life-saving medicines and that facility is available for all poor and rich people there. By the term access to essential medicine according to World Health Organization, the actual meaning is option A is affordable medicine for asthma and cardiac arrest only. Affordable medicine for all near 1 hour distance. Option C, 2 good quality medicine stores every street. And option D, pockets of pills and syrups are given every week to everyone.
B.
Yes, B is the right answer. MCQ number 4 is a physician cannot speak particular language while posted in Gilead. His understanding of patients' problems is poor. The insecurity to engage with patients, misunderstanding of the patient's negative impact on shared decision making, or more time consuming communication are all the examples of culture and behavior. These often serve as option A is the first tier in health care building blocks. Option B is second tier in healthcare building blocks. C is third tier, and D only few aspects about these are important.
First answer.
Yes, option A is the right answer. Option MCQ number 5 is in a district of a developing country, the healthcare system invests 4 doctors, 7 staff nurses, and other paramedics in a small hospital. About 16 patients are completely recovered from typhoid fever and discharged home. Regarding monitoring and evaluation of health system output, uh, here in this situation is option A is doctors and staff given, B providing medicine for typhoid fever, C recovery and discharge of patients, option D is complete coverage of typhoid from their area.
A.
Option C is the right answer, recovery and discharge of patients. Doctors and staff given, option is input, these are not the outputs. MCQ number 6 is data collection is an important tool in service delivery of healthcare building blocks. It has different forms. While collecting data, periodic census of all public and private healthcare facilities within a country is said as option A, routine reporting system. Option B is routine health facility reporting system. Option C, health service facility survey. And option D is health facility census.
B.
Yes, B is the right answer, health facility census. MCQ number 7 is if 10,000 people reside in a district of Punjab, to provide appropriate healthcare facilities to all, the minimum number of physicians that are practicing in this district should be at least option A 19, option B 23, option C 29, and option D 33.
23. B.
Yes, B is the right answer, 23. MCQ number 8 is service delivery is the first building block of health system according to WHO. Services are directly and permanently accessible with no undue barriers of cost, language, culture, or geography, and health services are close to people there. This feature is considered as option A, comprehensiveness, option B, continuity, C is accessibility, and D, accountability.
C.
Option C is
C.
the right answer. Yes, C is the right answer, accessibility. MCQ number 9 is healthcare information is an important building blocks of a WHO health system. The determinants and the coverage of use of services and health outputs, and including key stratifiers such as sex, socioeconomic status, ethnic groups, and geographical locations, all come under the umbrella of A is health outputs, B health inequities, C health processes, and D health determinants and outcomes.
D.
B is the right answer, health inequities. MCQ number 10 is direct user charges is the process in which rich pays the same fee as the poor, which deters some people from seeking or continuing care. All should pay equally falls under which category of financing? A is progressive approach, B is regressive approach, C is static approach, and D recession approach.
B.
Option B is the right one, regressive approach. This is the key. These are my references and thank you.
Thank you very much. Very well done, Dr. Isma.